Let's see an NCLEX RN video based on care of patients with musculoskeletal trauma. The principal assessment of a patient with an injured extremity includes which of the following? History of the injury, past medical history, the 6 P's, extremity movement. All are important to assess, but the 6 P's may indicate neurovascular compromise of the injured area and may necessitate immediate medical intervention to prevent permanent damage. The 6 P's of compartment syndrome are passive pain at rest, along with pressure, paresthesia, pallor, paralysis, and pulselessness. The nurse understands basic treatment for a sprain or strain includes which of the following? Keep extremity dependent to increase the blood flow to the area. Maintain rest of injured extremity. Apply ice to injured extremity. Maintain compression to injured extremity. Keep extremity elevated to decrease the swelling. RISE. That is the acronym which is said as the preferred treatment. So you need to maintain rest of the injured extremity R. Apply ice to the injured extremity I. Maintain compression to the injured extremity C. And E is keep extremity elevated to decrease the swelling. If we maintain the extremity in a dependent position, it would increase the swelling. The nurse explains external fixation is used to stabilize a fracture for which of the following reasons? The involved extremity is too large for a cast. The patient is not a safe candidate for open reduction and internal fixation surgical procedure. The extremity has significant soft tissue damage at the fracture site. The patient has a closed, non-displaced fracture that does not require open reduction and internal fixation. External fixation requires a surgical procedure and is done when there is significant soft tissue damage around the fracture site. It allows for visualization and wound care. Enclosure of extensive wounds in a cast is not recommended as wounds could be evaluated or cleaned. A closed, non-displaced fracture does not require external fixation. So here the external fixation is for the extremity has significant soft tissue damage at the fracture site. Which statement by the patient indicates effective patient teaching has been done regarding phantom limb pain after an amputation? This pain means I may have intact nerves that are required for successful limb reattachment. There is nothing that can be done for this pain. My foot is gone. So do you think gabapentin might help with this pain? I understand massage of the residual limb helps with this pain. The administration of antidepressant and anticonvulsant medications such as gabapentin has demonstrated effectiveness in treating phantom limb pain. It does not indicate intact nerves. It can be treated with medications. Touching the residual limb may increase the pain. So this is the best statement which is to be given. The nurse understands which of the following statements are correct concerning carpal tunnel syndrome. Carpal tunnel syndrome is a complication of a wrist fracture. CTS is due to repetitive motion of the wrist. CTS is treated with immobilization in a cast. CTS cannot be corrected by surgery. Carpal tunnel syndrome is due to repetitive motion of the wrist. leading to inflammation and compression of the median nerve. It can be treated with anti-inflammatories and carpal tunnel release surgery. It is not a complication of a wrist fracture and is not treated by immobilization with a cast. The nurse recognizes that the stretching or tearing of a muscle or tendon occurs in which condition? Strains, dislocations, fractures, sprains. A strain is a stretch or tear affecting the muscle itself or a tendon. Tendon is the tissue that connects the muscles to the bones. Dislocations are separations of joints such as knees, elbows, shoulders, and fingers. Fractures are break in the continuity of the bone. Sprains are the stretching or tearing of ligaments. So here the answer is strain. The nurse identifies with which pathophysiological finding in a third-degree sprain? Stretched muscle or tendon fibers, torn or ruptured ligaments, torn or ruptured muscle or tendon fibers, stretched ligaments. A third-degree sprain is the most severe. The ligament is completely ruptured. The joint is unstable. There is severe pain and swelling, and other tissues are often damaged. Stretching muscle or tendon fibers occurs in strains. Torn or ruptured muscle or tendon fibers occurs in strain. Stretched ligaments occur in first degree or mild sprain. The nurse correlates which diagnostic result for an elderly patient with a suspected pathologic fracture. Decreased bone density, increased osteocytes, hypertension, coagulopathy. Decreased bone density leads to increased risk of fractures. By age 35 in women and 55 in men, bone mineral density decreases by 1% per year. There is decreased osteoblastic function with normal aging. Increased osteocytes occur in bone synthesis and healing. Hypertension does not affect bone structure. Coagulopathy does not alter the bone structure. A patient has returned from the post-anesthesia care unit after having surgery to have an external fixator placed for an open tibia fracture with extensive soft tissue damage. What should the nurse do immediately? Conduct a neurovascular assessment, elevate the extremity, perform pin-side care, remove the dressing and assess the wound. Tibial fracture complications include compartment syndrome and primary wound infection. The lack of overlying musculature results in a weak blood supply. The nurse should conduct a neurovascular assessment to ensure that there is no alteration in circulation, movement, and sensation that may occur secondary to external fixation. Elevate the extremity after the wound assessment is performed. Pin-side care usually occurs after post-operative day 1. Only the surgeon should remove the surgical dressing that was placed during the surgery. The nurse correlates which of the following critically low laboratory results with a traumatic amputation. Hemoglobin 7 gram per deciliter, glucose 60 mg per dl, blood urea nitrogen 10 mg per dl, WBC 4000 into 10 raised to 3 millimeter cube. A critically low hemoglobin is due to severe hemorrhage. Hypoglycemia not caused by hemorrhage. A blood urea nitrogen of 10 is normal. A low normal white blood cell count does not result from hemorrhage. So here hemoglobin 7 gram per deciliter is a critically low laboratory result with a traumatic amputation. A diabetic patient who had an elective below-the-knee amputation returns to the unit for antibiotic care, IV antibiotic care on post-operative day 3. Upon closer examination, the nurse notices the patient has a pillow under the residual limb. What should the nurse do in this situation? Leave the pillow in place to prevent dependent edema. Remove the pillow to prevent contractures. Remove the pillow to prevent venous thromboemboli. That is what VTE is. Leave the pillow to promote circulation. Leaving the pillow in place will promote the formation of contractures. Removing the pillow will reposition the residual limb in a less limited position and allow for normal healing. So the nurse needs to remove the pillow to prevent contractures. Leaving the pillow is not appropriate as this will contribute to developing the contractures. Pillow do not contribute to venous thromboemboli. Immobility results in venous thromboemboli. Removing the pillow might promote circulation but not as well as physical therapy and range of motion exercises. The nurse prioritizes which nursing diagnosis in the patient immediately after arthroscopic surgical repair of the medial meniscus injury. High risk for ineffective airway clearance related to general anesthesia. High risk for ineffective breathing related to intubation. Self-care deficit related to pain, edema and immobility. Pain related to inflammation. Due to the side effects of anesthesia, airway is always the priority concern in post-operative patients. Airway should be prioritized before breathing as a compromised airway will negatively affect breathing. Self-care deficit related to pain, edema and immobility is not an immediate life-threatening concern. Pain related to inflammation is not an immediate life-threatening concern. So here, high risk for ineffective airway clearance related to general anesthesia is the immediate concern. The nursing diagnosis, ineffective peripheral tissue perfusion related to deficient knowledge of aggravating factors applies to which fracture patient with the highest risk of developing venous thromboemboli. A 30-year-old female on oral contraceptives who smoke 1 pack of cigarettes per day, a 40-year-old male who ambulates 4 times a day with a walker, a 70-year-old diabetic female who attends rehab once a day, a 20-year-old male who smokes 10 cigarettes per day and ambulates with crutches. Oral contraceptives combined with cigarette smoking dramatically increases the patient's risk of peripheral vasoconstriction, leading to decreased tissue perfusion. Using a walker promotes the tissue perfusion. Rehab promotes tissue perfusion. While smoking does lead to decreased tissue perfusion, the risk is lower than when combined with taking oral contraceptives. So here the first patient is at greater risk of developing a venous thromboemboli. White is a 29-year-old male involved in a head-on motor vehicle collision. He was ejected from his vehicle and his right leg was trapped under the vehicle. He is awake, alert and yelling from severe pain in his right leg. Upon closer inspection, he has an open right femur fracture that is bleeding profusely and is missing a chunk of muscle. The EMS placed his right leg in a hair traction splint, started 2 large bore IV lines and transported him to the emergency department. His breath smells of alcohol and his family member states that he was at a college party. He has no past medical history and is not allergic to any medications. White demonstrates classic symptoms of an open displaced femur fracture. The emergency department provider immediately consults with the orthopedic surgeon and 45 minutes later he is taken to the operating room. After significant irrigation of the open right femur fracture, the surgeon conducts an open reduction with placement of an external fixator. White is admitted to the ward from the operating room at 6 in the morning. Frequent nursing assessment noting the 6 P's are performed to assess neurovascular function. Laboratory testing to include serum myoglobin and CPK are ordered. Her urine remains clear yellow, ruling out the presence of rhabdomyolysis. His pain is controlled with peroral oxycodone. His provider's orders include the provision of adequate hydration and nutrition and an order for physical therapy to evaluate his readiness for exercise and ambulation using assistive devices. If he continues to improve, he will be discharged to home soon. White has undergone placement of an external fixator for an open displaced femur fracture. Immediately following surgery, he begins to exhibit dyspnea, pleuritic chest pain, anxiety, and tachycardia. The nurse suspects which complication? Pneumothorax, deep vein thrombosis, fat embolism, myocardial infarction. Although a pneumothorax, that is air in the pleural space, a deep vein thrombosis that breaks off and becomes a pulmonary embolism, and fat embolism would have similar symptoms, long bone fractures have a high risk for fat embolism due to the disruption of the bone marrow. Myocardial infarctions are not typically associated with fractures, especially in young people. So here the nurse needs to suspect the complication of fat embolism. Following the surgical procedure for an open displaced femur fracture, what action does the nurse frequently perform? ROM exercises, neurovascular assessments, dressing changes, pain assessments. Neurovascular assessments should be performed frequently to ensure that circulation, movement, and sensation remains intact. Range of motion should not be conducted until the surgeon has ordered it. Dressing changes are typically not performed until after the surgeon has removed the operative dressing and has written an order for wound care. Pain assessments are important but not prioritized before neurovascular assessments. The nurse monitors for which common symptom of compartment syndrome? Passive pain at rest, pain with movement, pallor, paresthesia. Passive pain at rest due to blood and fluid accumulation underneath the fascia which compress the nerves and blood vessels is specifically associated with compartment syndrome. Pain with movement is not uncommon with new fractures and is not a specific symptom of compartment syndrome. Pallor and paresthesia may occur with compartment syndrome but are late signs and are not strictly specific to compartment syndrome. Because White has lost a significant amount of blood, what complication should the nurse monitor for? Bradycardia, hypotension, metabolic alkalosis, hyperkalemia. Severe blood loss contributes to low hemoglobin and hematocrit, possibly resulting in hypotension. The nurse should expect to monitor for abnormal lab values, notify the physician, and prepare for transfusion of blood products. Bradycardia is not a sign of hemorrhagic shock. Tachycardia would be expected. Metabolic alkalosis is not caused by severe blood loss. Metabolic acidosis would be expected with severe blood loss and hypotension due to the presence of anaerobic metabolism. Hyperkalemia is caused by the lysis of blood and muscle cells spilling the cellular contents into the intravascular space. The nurse monitors White for which signs of rhabdomyolysis? Bloody urine and abdominal pain, anuria, nausea and severe flank pain, low serum myoglobin fever and severe headaches, elevated serum myoglobin tea-colored urine and severe flank pain. Rhabdomyolysis occurs when there is excessive tissue ischemia caused by swelling and muscle cell compression. Myoglobin is released from the dead muscle cells and travels through the vascular system, eventually to the renal system, and becomes lodged in the nephrons, limiting the renal function. In addition to the increased myoglobin levels, the patient presents with dark tea-colored urine and flank pain. So the nurse need to see for elevated serum myoglobin, dark tea-colored urine, and severe flank pain to rule out the signs of rhabdomyolysis. Hope you understood this video. Thank you so much. Keep to watching.